Let's say you've just been diagnosed with rheumatoid arthritis, or you've had rheumatoid arthritis for some time and you're considering vaccinations. What do you need to think about? Hi, I'm Dr. Nicole Arish, and I'm a rheumatologist. Today I'm going to discuss vaccinations in patients with rheumatoid arthritis. You can go to our website, www.rheuminfo.com, and download one of our handy vaccination pamphlets to follow along with this video. When considering vaccinations in patients with rheumatoid arthritis, there are a few things that need to be considered. To make things easy, I'm going to divide this talk into 3 parts. Part 1, vaccines patients with RA can receive at any time, regardless of their medications. Part 2, vaccines patients with RA should receive, but only under specific circumstances. And Part 3, special vaccines. Part 1, vaccines that are safe and recommended for all patients with rheumatoid arthritis. This is quite easy because there are just a few vaccines to remember. The first is the yearly flu shot. The second is a vaccine to help prevent pneumonia called Pneumovax. And the third is the vaccine for tetanus, diphtheria, and pertussis. Let's start with the flu shot, or influenza vaccine. This is given yearly to protect you against the flu. The vaccine is recommended for people who are over the age of 50, have a chronic illness like RA, and those who are immunosuppressed, which is what happens with RA medications. Therefore, the most important thing to know is that everyone with rheumatoid arthritis should receive a yearly flu shot. The flu shot is safe for all patients with rheumatoid arthritis, regardless of what medications you're taking. The second vaccine is called Pneumovax. This vaccine helps to prevent against infection with the bacterium Streptococcus pneumonia. The best time to receive this vaccine is as soon as you're diagnosed with RA. Otherwise, this vaccine should be given about every 5 to 10 years. After the age of 65, just 1 dose is needed. It can be given at the same time as the flu shot. The third vaccine is the vaccine for tetanus, diphtheria, and pertussis. Fortunately, these are all quite rare diseases. This vaccine should be given every 10 years. Part 2. Vaccines that patients with rheumatoid arthritis should be very careful with. As you know, vaccines are all different. Some vaccines are actually live versions of the infection. The vaccine for chickenpox and shingles, called varicella zoster, is an altered live vaccine. The vaccine for measles, mumps, and rubella, MMR, is also live. If you're taking medications that suppress your immune system, like many patients with RA, these vaccines could actually cause disease. The best time to receive these vaccines is when you're first diagnosed, before RA medications are started. There are a few other live vaccines. These include vaccines for yellow fever, oral polio, salmonella, and the nasal version of the flu shot. Part 3, other special vaccines. There's a lot of news and media coverage about protecting from hepatitis A or B infection when traveling. Unfortunately, we don't know how well these vaccines actually work in patients with rheumatoid arthritis. We recommend vaccination against hepatitis B when there's a risk of infection. Your risk for hepatitis B increases if you have unprotected sex with more than one partner, have unprotected sex with someone who's infected with hepatitis B, have a sexually transmitted disease such as gonorrhea or chlamydia, are a man who has had sexual contact with other men, share needles during intravenous drug use, share a household with someone who has chronic hepatitis B infection, have a job that exposes you to human blood, receive hemodialysis for end-stage kidney disease, travel to regions with high infection rates of hepatitis B, such as Africa, Central and Southeast Asia, and Eastern Europe. The media and press have also had a lot of interest in the human papillomavirus, or HPV vaccine. HPV is spread through skin contact during sexual activity and can cause cervical cancer in women. Vaccination against HPV is important because it can prevent most cases of cervical cancer in females if it is given before a person is exposed to the virus. I hope you found this video to be useful. For more information, please visit our website, www.rheuminfo.com, and download our handy guide to vaccinations.